Hi, I am Dr. Minish Jain for Cancer Talks. So the question comes up like, what are the guidelines of who should be doing the screening? Now, if we look at age wise, who should be doing screening? If it is age 21 to 29, then colon screening should be done by people who have high risk or genetic disorders or family history. Then only it is recommended. For an average population, it is not recommended. For breast cancer, again, if somebody has got a family history, high risk situation, you do testing in this age, otherwise it is not recommended. Cervical cancer, you don't have to do screening before age of 25, but 25 onwards you can do either an pap smear or an HPV test or a co-test. If you are doing pap smear, then you do it every 3 years. If you are doing a HPV, do it every 5 years. If you do co-test, that also should be done every 5 years. And you don't have to screen for lung cancer or prostate cancer at this age. If you are 30 and 39, you still don't have to screen for lung cancer and prostate cancer. But if you are 30 to 39, the colon cancer thing remains same. You do it again for high risk situation, family history of cancer. Do not do it for general population. If it is breast cancer, don't do it for general population. High risk situation should undergo screening. For cervical cancer, we all know from 25 onwards screening starts. If you are aged between 40 and 49, then for colon cancer, it should be started at age of 45. Routine people should be screened. If it is high risk, definitely we know that we have to start from 21 to 29 age also we are starting. And for people with breast cancer, don't have to screen them before 45. But yes, for some people who are between age 40 and 45, if they are concerned or if they feel something suspicious, they talk to their doctor, look at the benefits and risk of doing screening, and then go ahead with the screening program. For cervical cancer, we already know that we have to continue after age of 25. For lung cancer, we don't have to screen them up to age of 50. For prostate cancer, in certain high risk situation, you can start screening at age of 45. Otherwise, after age of 50. If there is especially like two people in the family or distant relatives being positive, or if there is father, brother, or son affected of prostate cancer, then also they can be screened at an age earlier. Between age 50 and 60, all people of colon cancer should be screened. For breast cancer, everybody should be screened initially yearly, thereafter 2 yearly. So up to age of 55, they can be screened yearly. Thereafter, they can be screened every 2 years. And this should continue up to age of 65. Beyond that, there are certain different guidelines. We'll discuss that. If it is cervical cancer, you continue screening up to age of 65 with this kind of situation. Lung cancer, you start from age of 50 if a person is smoker, especially if they have been smoking 20 cigarettes a day and they have been smoking for 20 years, then this becomes 20 pack years. Or if somebody is smoking 2 packs, that is 40 cigarettes a day for 10 years, then also it is called 20 pack years. And that is a situation where a person requires to undergo low dose CT to find out whether they have an early cancer in their lung. And prostate cancer, an average population should be screened after age of 50 with PSA and whatever we discussed, DRE. If it is age 65 and above, then colon cancer should be screened up to age of 75. Beyond 76 to 85, they should be discussed, and beyond 86, there is no role of doing screening for them. If it is breast cancer screening, then you have to continue it 2 yearly, and you can continue it as long as you feel that the patient is going to survive next 5 to 10 years. If it is a cervical cancer, you don't have to screen them beyond 65 unless they had a pre-cancer situation where they have to be screened 25 years after their last pre-cancer diagnosis. If it is lung cancer, you continue screening them yearly if they have been smokers. And 15 years minimum should be the time from their quitting of smoking. That should be the time. So if they continue to smoke, you need to continue their screening program. And if it is prostate cancer, you should screen them up to age of uh, 81 and or 10 years if you are expected to survive, whatever. So there is no upper limit, but if it is expected to survive another 10 years, we have to do prostate cancer screening also.